Assalamu alaikum. Welcome to our health-related special show, Bangkok Hospital's present Health Talk. I'm Nusrat Jan Deepa, and today we are very honored to have a special guest joining us from Bangkok Hospital headquarters, Thailand. Dear viewers, today we have with us Dr. Soarawee, experienced in Uro-oncology and Andrology, and also we have with us Dr. Sorasakdi, experienced spine surgeon in minimal invasive spine surgery. Dr. Soarawee and Dr. Sorasakdi, welcome to our show. And to be honest, we are very glad to have you with us, and of course, look forward to your valuable and important discussion. So now we will start with our discussion with Dr. Soarawee. So may I ask you a question before we begin our discussion? Okay, is this your first time visiting in Bangladesh?
That's right. It is my first time here, and I am very excited.
Okay, so how are you now?
Very excited with everything, all the atmosphere here.
Okay.
Yep.
Okay.
And also this show as well.
Okay, I'm sure that you have treated so many patients from Bangladesh.
That's right.
So could you please tell us briefly about common problems that you have noticed among Bangladeshi patients?
I have to say that very varieties. Can we start with a prostate disease, erectile dysfunctions, prostate cancers, or everything about stone, kidney stone, bladder stone, everything.
So those are very common problems.
That's right.
Okay. And we want to know about erectile dysfunction and about testosterone deficiency. We also know that this is the common problem among male patients. So
right.
what do you think that those who are suffering from erectile dysfunction, so what is your advice, or what will be your advice for very fastest way to cure the erectile dysfunction?
Okay. Actually, I always talk to the patient that we can treat you definitely, but I need their help as well. I always tell them that there is no any magical treatment for you. You have to help me. So I tell them that you need to control your diets, you need to do exercise, you need to sleep well, and you need to do some stress release, and then that is the best natural way to improve erectile dysfunction.
That means stress relief and sleep is very important.
That's right.
Okay, what about their food habit?
You mean diets, right?
Yes, exactly.
Healthy diets.
Okay.
Low fat, high fibers.
What about trans fat?
Trans fat. It has been confirmed that the trans fat is not good for our health.
So we should maintain a healthy lifestyle, right?
That's right. We must avoid.
Okay.
Right.
So I have one more question, or you can say that query. I don't know what you say about that. Is that misconception or any scientific explanation that can lack of testosterone is the main causes of erectile dysfunction?
Lack of testosterone is one of the main causes to make someone suffer with erectile dysfunctions. The testosterone not only affect the erectile dysfunction, but it represents general well-being. So the testosterone level is very, very important in gentlemen.
So what is your advice for that?
Again, testosterone it can be maintained very, very well if you can do a regular exercise. So I always do recommend to the patient that you need to do a regular exercise. Anything you can do, jogging, you can do bicycling, you can do swimming regularly.
That means physical activity is very important for
That's
us,
right. That's right.
both male and female, right?
That's right.
Okay, so do you have any advice for our audience or your patients?
Okay, I will do recommend to them like this. To me, not only a urologist that Bangkok Hospital headquarters do provide. We do provide everything. We do provide a one-stop service for every kind of disease. So we welcome Bangladesh people to visit us, and not only for the treatment, you can also enjoy sightseeing our country.
Okay, thank you so much. Now we will start our discussion with Dr. Sorasakdi. How are you?
I'm fine, thank you. And you?
Okay, and I'm fine, Alhamdulillah. And as usual, I'm asking you, is this your first time visiting in Bangladesh?
Yes, it's the first time here. And like Dr. Soarawee said, I'm excited to be here and excited to give information to the viewers at home.
Okay, Dr. Sorasakdi, as we know that you are specialized in minimal invasive spine surgery. So could you please tell us or share your experience for our audience that what are the most updated technologies that you are using at Bangkok Hospital and what are the most common technology or techniques?
Okay, so first of all, our hospital, Bangkok Hospital, has many new technologies because we always keep up to date with the technologies in the world. So right now, the technology that we use to help with the surgery is a navigation system. Basically, we use like a computer and to take like a 3D X-ray inside the operation room for us to help with the program to guide the fixation of the patient's back, to get accurate, almost 99 to 100% accuracy of fixation, or like for the surgery. And other things we have now is we now use an endoscopy, like a small camera to assist with surgery in the spine. So basically we use a very small equipment. So the wound, the wound size, the cut is only around 0.8 centimeters to 1 centimeters big. So it's very less painful and will help with the faster recovery.
So those are the common techniques?
Yeah, this is the mainstream equipment that's used in the spine society right now in the world in Southeast Asia.
We also want to know that what is the success rate of minimal invasive spine surgery and what is the recovery time for this surgery?
For minimal invasive spine surgery, basically it's different from the traditional way where we have smaller incision, cut wounds. So what it does, it helps with the recovery time. So the patient would stay for maybe 1 to 3 days instead of having to stay up to 5 to 7 days when you do the normal or like the traditional operation. And for the success rate, I would say that it's as good as the traditional way, even with the smaller incision and cut wounds.
Okay. Is there any follow-up system or maintenance system?
You mean like following up the patient?
Exactly.
Normally, we will, for the length of stay, would normally, when the patient is discharged from the hospital, we would follow up to look at the wound again at around 7 to 10 days, okay, or sometime up to 2 weeks, depending on if the patient is of old age or if they have any other disease. And after that, we would follow again up to 1 to 2 months, normally, to check up again if the surgery is successful or if the equipment or the instrument we put in is in good place, like no problem. Yeah.
Okay. And what would be their food habit after their surgery?
The food habit? Similar to what Dr. Sahi said, so a healthy diet. So try to avoid...
For example?
Yeah, okay. So basically try to avoid a lot of sugar, food with high sugar, and food with a lot of fat, okay? And try to have like a high protein diet, yeah, but not too high, like a good amount. And also the important thing is to not have any smoking. Yeah, it's gonna be very bad for the...
Should be avoid smoking.
Yeah, should avoid.
And what about physical activities?
Physical activity, normally with minimal invasive surgery, the first 2 weeks, you can do light activities such as walking or just doing your daily life activity, it's fine. And when you want to return to driving or other activities, maybe you have to wait about 1 month. Normally.
And also we know that lower back pain is the most common problem among corporate employees, in general people, homemakers, students, everyone. So how do I know that my lower back pain is much serious, or what is the severe symptom of lower back pain?
Okay, that's a good question. So
For lower back pain, I mean, everybody has lower back pain, like from like just sitting down or from driving a long time or from just working long hours. So the symptoms that I would say that is going to be like alarming for the patient for the patient or employee would be the back pain accompanied by leg pain. Because leg pain or numbness of the leg or weakness of the leg, these symptoms indicate that the patient might have some nerve compromise from the back, maybe like a disc herniation that could cause it. And other things would be if the patient has back pain for like more than 3 months, I would say like that taking medications or doing physiotherapy doesn't help, then maybe he or she needs to get it checked. And other things would be if you have back pain with like fever or like any other symptoms, would have to go get it checked because it could be from infection or it could be maybe a cause of cancer or something too.
Okay.
Yeah.
Do you think that physiotherapy is good for lower back pain?
Physiotherapy is one of the treatments that needs to be done. Okay. I mean, it's one of the first few treatments that I think helps a lot because it can help release all the stress in the muscle that causes the pain. And it could also help strengthen the patient's other back and core muscle, like to provide a better lower back health, I would say.
Okay, so do you have any advice or suggestion for our audience and your patients?
I would say that a good healthy lifestyle would be beneficial for your lower back health. So first of all, you should keep a good diet and also try to maintain a good a body weight. So
not sleep.
Yeah, and sleep, and also try to do exercises and don't sit for more than 2 to 3 hours when you're working. Try to stand up and do some stretches.
So it's a complete package, right?
Yeah, it's a complete. Everything together will help for the audience to have like a better health for the lower back pain.
Okay.
Yes.
Okay. Thank you so much, Dr. Soarawee and Dr. Sorasakdi. Thank you for joining with us, and thank you for giving us such a valuable information. Thank you again.
Thank you.
Dear viewers, that's all for today. Remember, staying informed is key to good health. Until next time, take care and stay well. Allah Hafiz.